not going to fill up my Bentley with, whatever the average gas is. It's got to be high octane. And I think I just saw RFK say he wants all pharmaceuticals all produced here in the United States. That's not freaking reasonable. I'm sorry.
With the peptides, is there like an age limit?
Typically, we don't have an age limit in terms of our older population. It really just depends on labs and how
What's going on inside?
Yeah.
What's going on, everybody? Welcome back to another Living Well podcast. I'm joined by my secondary host here, Jack, and we have a lovely guest today, Miss Danielle with Momentum Integrative Wellness. Thank you for coming in.
Thank you.
Today, we're going to dive into a lot of the stuff with peptides, rejuvenative health, wellness, and it's going to be a good one. I'm very excited for this one. So, Miss Danielle, if you could just give us a little introduction about yourself, where you're from, plans, just a little something.
Yeah, well, thank you guys for having me.
Sure.
My family and I are transplants here to Florida, as with most people, and we came down about 2 years ago.
Welcome.
I spent about 20 years in the pharmaceutical industry, so that's really where I grew up and kind of cut my teeth. But it gave me a very unique perspective of about what our American medical system looks like, and I really call it the sick care system. So I say my professional career gave me some insight as to our medical industry, and life experience has made me understand why everyone feels so lost inside of it. And after leaving the pharmaceutical industry in 2020, I went into the coaching space, health coaching. I am a medical assistant. I'm a certified mental wellness coach, which is a fancy way of saying I've got a deep and strong background in gut microbiome and mental wellness via feeding yourself and keeping a healthy gut microbiome. And then I started my own consulting company last year, and in some unique diagnostics, talking about more gut health, more about healthy inflammatory levels, and looking at inflammation really in a different way that's much more useful and effective. And then peptides entered my world, and it has completely taken over, and we just opened up a clinic here locally in Stewart. We are a longevity and regenerative health clinic based on peptides, GLP-1s. We do hormone optimization, and it's been a whirlwind and a lot of fun, and I absolutely love helping healthy people stay healthier and live healthier, longer lives. So
Awesome.
a little bit about me.
Well, that's really cool. I know when we first met, you were talking, you had a friend or a partner that also has, a big position in the same world. How long have you been with her? How long have you guys been together on this?
So interestingly enough, she and I go back about 10 years. She owns one of the largest med spas in Maryland, and we both lived in Maryland. We both happened to move down here separately a couple years ago. And she's the only person I've really ever let touch my face in terms of aesthetics. It's important. You do not want to go to the cheapest injector out there, I can assure you.
Well, it's like haircuts. No one touches my head. It's like, listen,
I'm happy to pay the premium for a nice fade.
Yeah.
Got to. But imagine it's the same with the face. You don't want someone a little inexperienced botching you.
Sure. Every once in a while, do people run Botox specials? Yes, but you want to make sure that your injector comes with the premium in that training.
Yes.
So I don't say that lightly, because not only did she have a medical aesthetics spa in Maryland that has continued to grow, and she still flies up there to treat patients a couple days a week. She's worked in plastics, she's worked in wellness, hormone optimization, and she's been doing GLPs and peptides for the better part of 8 years now. So she's got a very extensive background, and we knew one another when I was still in the pharmaceutical industry as a regional director at that point. So we could always have forward-thinking medical conversations. And when I started working with peptides a year ago, and she was the one I would kind of go ask some additional questions to, and it became very apparent that we had a very synergistic working relationship. And I said, would you like to open up another location here in Stewart? I think we could really do something with this, with your protocols and with the way that you direct and guide patients to take their peptides and your extensive background in GLP-1s. Plus, I'd been coaching patients with achieving some really impressive body composition results utilizing GLP-1s. It just became a very natural, easy progression. So we decided to open up, had that conversation about October, November, got our lease in December, and opened our doors January 1st. So
very cool. Awesome. There's something about your background that's really interesting to me, and where you've come since then. You were in Big Pharma, right? And Big Pharma kind of has a lot of a negative connotation to it nowadays in the world that we live in post-COVID and whatnot. So what was it about being involved with Big Pharma that made you want to get away from that and then look at this new upcoming, more of a holistic regenerative approach to wellness and medicine? What kind of got you there?
So I can't say that Big Pharma is 100% bad, right? I think there's a good side and a bad side to everything. It's got its place when we have some really rare diseases and you need some medical therapies. And also, if they weren't spending the money on the trials, the human clinical trials, we wouldn't have FDA approved products to even begin to start with, right? So we do need some of that. But as a member of that industry, it's a bit of a soulless job because there are so many guidelines and regulations that you have to walk a very fine line in what you're allowed to say, what you can't say, who you're allowed to speak to, who you can't speak to. So it gave me an understanding and a background that I am so grateful for. I understand the human body in ways that many people don't. I spent my entire career, whether it was me or teaching my teams of representatives, how to break down medications for the medical providers to understand what these medications do in the body. And so that's why when I made the switch over to peptides, it was so synergistic because now I can actually talk to the patient themselves and explain what's going on. But I never was somebody who needed the sick care system other than being a lifelong asthmatic and I need some maintenance medications. I typically don't take anything. So when I went into wellness coaching in the supplementation world, I kind of tried to go the complete other direction. But then I started to look around, and I think you guys are going to know what I'm saying when I talk about this. People selling supplements and all of these supplement systems, why is it they don't themselves get healthier and physically look like they're the sickest of the sick? But yet they're telling you how their lives have been completely transformed by these natural systems. And so I said, I can't live here. I understand the wellness piece. I want to live in the wellness piece. And I really enjoyed my consultations with patients as I was trying to help them find the systems to change their metabolic dysfunction. And it wasn't there until we got to GLPs and peptides. But that piece was really the coaching of the client. And I found that I was really good at it. I could be like, okay, here's kind of where you are. We've got to start here, here, and here. It's not January 1st at the gym all the time because those type of restrictive protocols are just not sustainable. That's why everybody's gone by the middle of February.
Yep.
So I love coaching and counseling the patient. And I spend an hour with everybody who walks through our door for the first time.
I love it. So you're really taking a deep dive, all-in approach, trying to figure out what people's goals are, what could they do to optimize, be healthier, and really be well. You spoke a little bit about the sick care industry, right? Can you touch a little bit more on what's the difference between, what you refer to as the sick care versus this new rejuvenative approach with peptides and some of the other new approaches that are coming out?
Sure. So, when we're dealing with our medical system and the sick care system, we're all paying insurance. We're spending a boatload. And I think every year you see premiums continue to go up and up and up in what you're spending. And then you walk out of the doctor's office and you realize, what did all those dollars that I spent out of my paycheck go for? Because I'm still not covering anything. I'm still paying copays. I'm still paying co-insurance, deductibles, all of the things. And yet, my body physiologically isn't changing. My lifestyle isn't getting any better, but I can't even afford this medicine. And when you start to look at the things that you can do for your body, and you start to realize all the things that are coming naturally and healthy for me, my insurance doesn't cover anyway. You begin to realize, okay, my health is really my priority. We can no longer allow the doctors or the medical system to dictate how your health is going to be. And I think we as a society kind of got away from that. I think there's some generational stuff, grandparents,
Yep.
Doctors, lawyers, pharmacists, they're all on a pedestal because of the amount of education that they went to school for. And we started to kind of give away our power to believe that those people are smarter than us. But if you don't take your own health and do your own research and question the protocols that your doctors are prescribing for you and recommending, you just end up down a blind, path of nothing is
just
really
saying yes.
changing.
Yeah. I don't think you could answer that any better.
So
You answered that perfectly.
really on us. And I love taking that ownership approach to it.
Yeah. My dad once said, he's like, because my dad also competed in bodybuilding and stuff like that. And he's like, if you're going to take anyone's advice, at least take it from someone that looks good and that knows what they're doing.
Right.
You know what I mean? If some guy in the gym is, doesn't really have that physique, or, maybe has, just missing balances and telling me what I should do, versus someone who's got it all dialed in, head to toe. Probably listen to that guy. Just common knowledge. You know what I mean?
One thing that I see a lot, I was a personal trainer for 10 years, right? I don't have any sort of a medical background or anything other than a degree in exercise science, whatever. I'm not a nutritionist. I'm not a doctor. I've not been in that space. But what I've realized is that a lot of doctors out there that are looking to, fix people's problems, they don't have a background on nutrition. I think nutrition is very loosely touched on when people are going through medical school, and that's something that's extremely important. And then some of these new methodologies of treating people and making people well and working with, the rejuvenative wellness space, they're not too educated on it yet. And I think that there's a lot of pushback from doctors on some of these new peptides that are coming out. A lot of them have really, truly embraced the new science that we have. But I think a lot of people are old school, stuck in their ways, not really willing to adapt. Are you seeing that a lot? And is that why a lot more people are coming to you for these new modalities?
Well, I think the education that's out there is much more available. It's at our fingertips, right? I mean, we all know about the Insta bros telling you exactly what to stack and what to take and what, this and that. But
David.
but while that is beneficial in so many ways, right? It gets our creative juices flowing and allows us to say, hey, that sounds like a really kind of good idea. Let me do some of my own research. And honestly, I think that is the best thing that you can do. You can take a little bit about what you see healthy people doing, right? And then also every one of our biology is a little bit different. Genetics, lifestyle, and I think what makes us very unique at Momentum is the fact that, while I was doing a lot of that nutritional and health coaching, I also did a lot of resilience coaching. And so you have to understand where the person is. We might have very similar goals in terms of health and body composition, but where we are in our life today and what is realistic for a plan to implement might be very different. And so you may want to be the healthiest person on the planet, but you might be in a sandwich year of taking care of your aging parents while you still have kids in school. And whether you're a stay-at-home mom or you're the primary breadwinner, there's an added layer of stress there, right? So there's only so many changes somebody can make at one time. And I think you really need to sit down with somebody and understand, okay, we see where the goal line is. But again, we're not running all the way down the field for that long haul touchdown pass. And again, I'm not a sports expert, so I probably said that in a really silly way.
We're
just
touchdowns.
Incremental little movements forward that we can get gains from in our system. And the other thing too, you talked about nutrition not being a huge part of medical training. It is part of med school in the chemical sense, chemical nutrition.
Yeah.
But only, that's only a small portion of it. We can have all the nutritional training in the world, but we also need to understand that the food supply that we are dealing with today is not the food supply of 100 years ago. And as we have obliterated our groundwater and our soil and the seeds that are now mostly genetically modified, the nutritional content of a carrot is nowhere near what the nutritional content of a carrot was 100 years ago.
100%.
And it's crazy to say 100 years ago, because I think like 1950 was like maybe 50 years ago. But it's a lot closer to that 100 years.
Yeah.
Yeah. No, my wife came home with a thing of grapes, and they were like
massive.
All grapes. I'm like,
they were the size of your big toe.
Yeah, and it crunched like an apple. I'm like, that is not a grape. Like it was still good.
You're making me hungry.
They're very good.
And how long will that sit in your refrigerator without molding?
Exactly.
Or so not right.
Yeah, and all the stuff with the pesticides and whatnot. We know what's going on with the glyphosate and all that crazy stuff, but that's a totally different rabbit hole that we could dive into for maybe another pod.
But I just think that's one reason why peptides are so popular, because it's one thing that you can do for your body that is helping you combat all the other toxins that you can't avoid it, because you can't go live on a mountaintop in Iceland where there is so little pollution and toxicity. We have to live in the society that we're in. So what can we do to make it more healthy for our bodies? And that's really where the peptides come in.
Love it. So I want to get like a really simple definition of what a peptide is out there for people? Because I know there's a lot of different peptides and they all have different nuances to them, and they are all very different. But just for the listeners that are maybe a little bit confused on the topic, I'm sure they've heard the word peptide 100 times by now. But what would you use as a good solid definition as a peptide?
Yeah. I mean, we'll take it back to like second grade health class, right?
For sure.
We hear that the building blocks of protein are amino acids. Peptides are just short little chains of amino acids. And so if you have a chain of less than 50, it's not a protein, it's actually a peptide. And what they do is they just tell your body to do something. They're little messengers that signal and say, hey, this peptide says, go to sleep. Let's repair your circadian rhythm. This peptide says, let's burn some fat. This peptide says, let's produce some growth hormone so that we can build up some muscle. There's a peptide for just about anything, right? And so they're just very simple molecules. And for the purpose of this conversation, what we're mostly talking about is the very clean injectable peptides. There are some orals that can be beneficial, but for the most part of what I'm speaking to, we're talking about the pure, clean, synthetic, lab created to mimic what your body produces, injectable peptides.
My question for you, Jack, on that too is, for the viewers at home that might not know exactly, how that works or how to classify it. Peptide's not a steroid. Is it a steroid? I don't think it's a steroid.
No, it's definitely not. And peptides and steroids get grouped together a lot because you're like, okay, let me inject something into my body. Usually when people think of injecting something, they're like, oh, you're taking steroids. Even with creatine back in the day. I remember taking creatine in high school in the locker room at football practice. And dudes were like, oh, you're taking steroids. That's why you're so big, dude. And I'm like, it's creatine. Like, get over it. And now, obviously, everyone's taking creatine.
Yeah.
It's
number one most studied chemical.
Absolutely. Yeah. For many years, we've known that creatine is very safe, very beneficial, absolutely not a steroid. And now people are really coming around to agree with creatine.
Because it's been studied for so long and there's so much data. I mean, I think it's smart to be skeptical, but I think the average consumer listens to the headlines versus actually, looking under the hood and doing a little bit of research. I mean, creatine, in my opinion, it's one of the most terrible tasting things.
Oh my gosh.
Oh,
yeah.
I just choke it down in a protein shake. I've tried to put it with some coffee and some chocolate, just get the whole thing in real quick. But it's great for brain health. It's great for women in perimenopause and menopause. We want to support muscle build, right? Muscle is a longevity metabolic part of your system. If you don't have a lot of muscle, your bones are going to be too brittle as we lose bone density as we get older. So muscle is one of those things that keeps us active and healthy longer.
One of the things I was going to lead into kind of like why peptides are really good, and with muscle, how important muscle is on your body. I think I saw the other day, there were 2 MRIs of an older person's thigh and their bone structure and their muscle mass. And the triathlon or the healthy gym goer had, far more muscle tissue on their body, easier to move. They're both the same age. The other person, much more fat, adipose tissue, all that extra stuff. You can right there predict, longevity, pain. It's really cool to see, what something can do so much for you, just focusing on something as simple as a muscle.
And I know exactly. There's a picture of it.
Yep.
It's a picture of a quadricep, right? And you're looking at one side, which is the healthy, active person who was a triathlon athlete at 70 years old, still working out, and then a sedentary person. And you were looking at, like you said, all the adipose tissue and the fat. But you could also see that was a very brittle femur that you're looking at there versus the other one that looked strong.
Yeah. It's muscles. It's exactly what you just said. It's what moves your bones. It's what's keeping you going. So with the peptide, it's safer, right? It's not a steroid. It's a lot, easier to track and watch. Can you kind of walk us through, like, in that realm, kind of the differences and, what's really great about it?
So I kind of want to stick with the muscle mass for a minute because
muscles are our favorite topic. So we could talk muscles all day long.
Right now, I'm just really happy that we're moving away from the body positive movement of, hey, let's just be happy that we have a body that we're living in.
Yes. We're going to have to keep you on the podcast.
Just like make the body the temple that we have to, or it's our home, right? Like you got to do maintenance on it. And so it's not about being skinny fat. There's so many people that want to lump, and I love to talk about GLP-1s because GLP-1s, They are peptides. A lot of people think that there's this terrible, dangerous weight loss shot to get skinny, because some people you'll see are going to abuse them and use them in a way that is not necessarily appealing to the eye and ideal for body composition and longevity and health and such. And every, quarter inch less that we have around our waist, we're increasing our lifespan by X amount of years. I mean, chronic obesity leads to chronic disease, which leads to earlier death and more medications. So GLP-1s, they help to regulate your insulin, right? And insulin was the first peptide that was discovered in 1921. So insulin was the first peptide that we recognized all the way back in 1921. The GLP-1 data, the early GLP-1s that predate Ozempic, which is the generic name for it would be semaglutide. There's earlier GLP-1s prior to that, and that came out in the early 2000s. So first and foremost, we have long-term patient safety data on what utilizations of GLP-1s in the body do long-term. And the longer that we tend to have them out, and the more generations and iterations of these GLP-1s, GLP-2s, GLP-3s that come out, we're seeing these longevity effects in the cardiovascular profile, in your reduction of risk of Alzheimer's disease, in your pancreatic function, in hepatic function for older people. It's a slew of things that we're finding benefits. They're even showing right now tirzepatide, which was Mounjaro by brand name. It's early models in mice are showing a 20% reduction in breast cancer tumors, right? So a lot of positive things. So we can use GLP-1s to regulate body composition. And I find the clients that come to us, they see our transformations from ourselves. They see it from our other clients, and they say, if I can get rid of this fat, okay, and my body responded, how would it respond if I started doing things in the gym that I've never done before? And then you suddenly become really astounded by the fact that you can reduce fat and you can put muscle back on when everybody says you're going to lose muscle. Well, I like to say to the person who says, well, I really want to lose fat, but I'm afraid I'm going to lose muscle. And I say, so what have you been doing the last couple of years to preserve muscle or add muscle? Nothing.
How much protein are you eating?
Okay. So I'm not so concerned about what the medication is going to do to your muscle mass right now, because it's nothing that you can't come back from. But by taking the medication, in turn, I'm going to require or strongly recommend from my coaching program that we're going to have to up that protein from where you are. So this is a complete learning of a new lifestyle and learning your body, but to see the transformations people make and reduce that fat and start to build muscle in ways they've never had it. I mean, it is really, really cool.
Well, one thing that we said before, which is kind of somewhat similar to what you just said, was one of the segments we did is some phrase you'll hear is some women don't want to get too bulky lifting weights. And that couldn't be more contrary of what it actually does. So what you just said reminded me of that a little bit. Because a lot of times, people do like a peptide and not have proper nutrition or work out or do those things. It's a whole unit. You have to have that ecosystem.
It is. But again, you don't have to make all the changes day one is what I tell people. And I actually just did a reel about this the other day. Most people are taking GLP-1s wrong, right? Your days 1 through 90, I want very minimal changes in somebody's lifestyle, because your body is going to start changing physiologically from the inside. And I want you to start to recognize and notice those cues, because you've been living. Most of my clients who come to me, they feel like their body is suddenly failing them. It's like, I'm doing all the right things, or, I've always done the right things. And I just kind of stopped because my body was changing and it wasn't reacting to the things that's always worked in the past. So I say, let's take the medicine and let's see how your body reacts. The only thing I ask of you to do is allow yourself to rest when you need some rest. Sleep is so important and probably the number one most underutilized tool that we have in our tool belt. Because people say, oh, I can sleep when I'm dead. No, you need that right now. Yeah, right. And then I need you to increase your hydration. But other than that, I just want you to pay attention to the foods and how they feel in your body, because that's going to tell you a lot about what you should and shouldn't be eating. So we just keep it very simple on days 1 through 90. We start making bigger changes after the first 3 months.
Yeah, and I think even if you were just having a consultation with someone today, just saying those things, I alone would trust you so much more, because you know everything about it, like the water, the food, the intake. It's not just that, but it's just so much. So you really know what you're saying. It sounds really good.
Yeah, absolutely. I'm curious. New patient consultation. What are some of the questions that you ask people when you're doing your fact finding to try and figure out what their pain points are, what they're looking to do in terms of, optimizing? How do you kind of direct the conversation to figure out what exactly is going to help this person?
So we do a pretty thorough intake. Again, prior to coming in and spending an hour with me, I'm going to send you what I call as my health optimization form. And it's going to dive into your energy. It's going to dive into your sleep patterns. It's going to dive into how you feel about how your body is responding in terms of weight and what level of weight loss is important to you. We're going to talk about a total health reset. Have you ever gone through a total health reset? How about cellular cleanses? What does your supplement routine look like? And let's talk about what your lifestyle is like right now. What's going on day to day? What's your job like? What's your family situation? What kind of life disruptors have we had? Big moves, family dynamic changes, medical illnesses, catastrophic, just, finance changes in finances. All of these lifestyle things are going to play a huge they're going to impact how much stress you're under, which is going to impact not only how your body is handling that stress and wants to preserve and hold on to fat, but at the same time, if you have low energy, we don't necessarily have to run a ton of labs day one. I'm not going to have you walk into the clinic and we're just going to start poking and prodding and testing a lot of things. There's plenty of things that we can do symptom-wise that are very safe without lab work to be done. And if you're being seen by your primary care doctor, because again, we are not a primary care doctor office. Most of our clients have a doctor. They get labs run about once a year. And there's something we can kind of look at from those labs. And so if they're interested in energy, we're going to talk about some energy options. If weight loss is really one of the big things, we can get them some big changes starting on GLP-1s pretty early on. If they're very active and they're very not interested in GLP-1s, we've got some unique peptide protocols that we could put them on to really enhance kind of like the benefits they're getting or the gains that they're getting in the gym that they feel like they maybe plateaued some. So it depends on kind of which direction they want to go.
I want to dig into this because that last little part that you touched on right there, I felt like you were kind of speaking to me a little bit. I'm a very active person. I live in the gym. I run a lot. I do a lot of cardio. I lift a lot of weights.
Baseball.
I play baseball. I'm not I've never been extremely interested in GLP-1s. Obviously, I'm a person that really cares about my body composition. I was a former bodybuilder, and now I am not. So there definitely is a little bit of the body dysmorphia thing going on in my brain, even though I still look pretty good, right? I'm lean, I'm strong, I have more muscle mass than most people out there. I'm active. GLP-1s have never been something that I have personally been interested in because I always thought I don't have a ton of fat on my body. I don't really need that. But as they're becoming more popular and there's more benefits coming out, and you're mentioning there's other peptides out there that could benefit what I'm doing, I just want to dig into that just for my own curiosity. What are some other things that I could do that would benefit me?
So I do love the growth hormone secretagogues. It's one of the things that, and again, you're a younger man, but typically if I'm seeing a male and they're somewhere between 40 and 60 range, right? And number one question is, okay, from the men is, do you guys do TRT? Because for guys, it's all about the testosterone.
Yeah. Oh, yeah. For the leaderboard.
I was like,
Let's pump that test up.
there's so much more we can do besides testosterone. And testosterone is really, really important. But if somebody is treatment naive to testosterone at this point, and they do exist.
Yeah. Oh, yeah.
They do exist. There are men out there in their 40s and 50s who've not been on TRT yet.
I'll take some right now.
You got something better.
Let me up.
Bring on down the TRT.
Right? We can try the growth hormone secretagogues first, and then we may be able to use less TRT, in total volume, because we still want our body to naturally produce it. We just want to adjunct it to it, right? We want to add to it. So I love the growth hormone secretagogues because they do also, if you're on the right ones, they can target the visceral fat where you've got it in places that you feel like you just can't kind of make those changes and get the gains. The other thing I'm going to talk to people about if they're not getting the gains in their muscle is like, what does your omega-3 levels look like? Yeah, fatty acids are a big one. And, here's kind of the hill I like to die on. People are testing, omega levels. Well, omega-3, omega-6, omega-9, it's a class of fatty acids. You don't just have one omega-3, you have multiple. And so if you're not running a report to measure your ratio of omega-6 to omega-3, you're really not getting a good look at what's going on. And so omega-3 is actually the basis of muscle protein synthesis. You think that you need protein to build muscle, but you can't utilize the protein to its fullest that you're taking if you're omega-3 deficient. And you will be omega-3 deficient if you have an overabundance of omega-6. So let me give you a little bit of a kind of back up and tell you omega-6 and 3, right? They're both fatty acids that you need. Your body doesn't make them, so you need to take them. But omega-6 is predominantly inflammatory, right? So we need that when we get injured, when we're sick, when any type of injury, you need those prostaglandins to come around. You need that inflammatory effect. That's very, very healing, right? So that's what omega-6 does. So we don't produce it. We have to ingest it. Omega-3 is an anti-inflammatory omega. We don't produce it. We must, take it, but it is anti-inflammatory. So you want to have the ratio of those two, and it sounds a little off, but you want it to be 3-to-1. You do still want more omega-6 than you do omega-3, but 3-to-1 is that sweet spot. But what does that mean internally for your body when you're at that 3-to-1 level? So if that ratio is 3-to-1, we're talking about the cell membrane permeability, right? So every cell has a membrane, and that membrane needs to allow nutrition, signals, fluids to flow through it.
Mm-hmm.
If that cell membrane is too rigid because it is over-inflamed with omega-6s, then it can't get the signals that it needs. It also can't expel the toxins that it needs to. And so the average American is 25-to-1. And we've studied that data because I work with a company who they actually own the world's largest, and this is so weird because omega-3s are not a sexy mineral or vitamin to talk about.
Mm-hmm.
Nobody talks about it. But once you go down the rabbit hole, it's like, oh, wait, this is actually really fascinating. So out of 1.5 plus million tests done worldwide, 97% of people are out of balance. They are more than 3-to-1. And you say, like, how is that possible, right? Because all doctors know to tell you to take a fish oil or an omega supplement, right? And a lot of people do if you can tolerate it.
Mm-hmm.
Never mind the fish burps that can happen. But even people who take those omega-3s regularly, they're still not in balance because it's not bringing down your omega-6. What causes your omega-6 levels to skyrocket? Well, it's our seed oils. It's the things in our meats. It's the hormones. It's all of the things. And again, I also want to put out the disclaimer that seed oil in and of itself is not necessarily bad. It's just how we process it.
Mm-hmm.
So our processing completely obliterates it. Now it makes it not good for us to have. So that increases your omega-6 level. So I know it's kind of a long science lesson, but omega-3, where do you find it? You find it in cold water, oily fish because we don't produce it. So when that omega-3 is found in this cold water fish, like think Scandinavia, Norway, like Iceland up there,
Nice.
Sardines, mackerel, salmon.
Gross.
Oh, you don't eat the fish?
It's like, like fish?
No, stop.
Oh, it's not a
Podcast.
Please continue. Please continue.
Love fish. Anyway, so you've got this omega-3 inside the fish, and as you go to extrapolate it from the fish and you need to purify it because of toxins and mercury and all the things, that omega-3 in nature is always found, like it's bound and wrapped in a polyphenol. So I think of like, what are those little fun, like Thai, Chinese, Vietnamese, like are they pot stickers or dumplings?
Oh, delicious.
Like, the inside the filling is the omega-3 and like the outside soft, doughy wrapper is your polyphenol. That polyphenol is what stabilizes your omega-3 molecule. So as you purify it, they strip away the polyphenol, but they don't put the polyphenol back in. So I'm telling people that your omega that you're taking on over the counter is junk. Just throw it away because it's not doing anything. Mm-hmm. And if we test you and you come back 3-to-1 in balance, we'll refund your money for it. But our tests show that you're probably going to come back about 25-to-1. So the company that we use for it's a balance oil. It's not a fish oil. It doesn't taste fishy. It doesn't smell fishy. You could put it on your salad, but it's easier just to drink it.
Okay.
It's a shot a day. And the reason, again, you want to build up your level of omega-3s because it goes back to the protein building conversation about you're going to plateau if you have low omega-3 levels. Low omega-3 levels also point to decline in mental function, mental capacity, and mental health disorders. And so they studied this at Walter Reed Hospital years ago and showed that our soldiers coming back from war, they had a 30 or 63% more higher suicide rate if they were low if they had suboptimal levels of omega-3. It's also responsible for recovery, helping faster recovery from TBI, traumatic brain injuries. So the reason that we talk so much about omega-3s in body composition, in muscle build, in our office is because people are looking for that muscle build. They're looking for that healthier lifestyle, and they're not trained on the fact that why they need omega-3s, and the fact that your doctor can't test your 6 to 3 level. So we do that in the office. Little finger prick test. We send it out, let you know where you are. And when your red blood cells turn over in 4 months, because that's the life of your red blood cell, we'll retest you again so you can see. And I think it's 95% of people, they're back in that 3-to-1 balance, or you're almost very close to it. So we just keep you on that little bit of balance oil regimen. So that's something for someone who is plateauing.
Yeah.
We're going to talk about your omega-3 levels. We're going to talk about your fiber intake to coat your gut so that it can process those proteins that you're eating properly. That way, you're getting the gains at the gym at 100% instead of a fraction of it, maybe 70, 75%. And you're killing yourself. And you're like, why am I not getting what I'm used to getting? And I know that's not a peptide, but that is a foundational piece of our nutrition that we talk about in body composition.
Yeah, the oils part is really spot on too. Cause like nowadays when you hear like people cook with fat or you cook with a lot of butter, we're like, whoa, don't do that. Just use oils or just use something a little bit easier to use. It's like the oil is actually destroying inside your body and it's off regulating your hormones. It's all your body's regulations are now just changed because it doesn't know how to process it. I'm pretty sure actually this could be wild.
First hot take of the day.
First hot take of the day. Boom, coming at you from me. We produced, I think it was in World War I and World War II, the United States produced an unbelievable amount of oil for the machines and tanks and trucks and stuff like that. And then we didn't use it all. So they were like, we can kind of make food out of this. And then they do all these testing on it. They take the smell away. They change the color because naturally it's white. And now you can cook French fries with it. Now you can fry a chicken patty. And now they didn't waste millions of dollars of oil. And now they just made so much money on it. So it's a hot take, but it's odd, how it stacks when we talk about pharmaceutical stuff. It's like, well, don't do this. Just take this. Just don't take anything else. Just take this. And the same thing with oils. Everything is made with oils now. My one buddy in college used to make fun of me because I think Chipotle uses a lot of seed oils. And we would go to Chipotle. He's like, I'm not eating it, dude. It's got seed oils. I'm like, oh, get out of here, Shrew. Get out of here. What are you talking about? I was way wrong. You know what I mean? So it's like the oil part is really a really strong factor. I totally agree with. One of my questions was with targeting, fat specifically with some of the peptides and stuff like that. Can you spot target or not really?
Not really.
Okay.
No. I mean, there's ones that are going to target more visceral fat in general, right? So you're not going to get massive fat loss gains from them. But like your growth hormone secretagogues, that's going to target some visceral fat. Your MOTS-C, your exercise in a bottle, we'll come back to that in a moment. I hate when they talk about it as exercise in a bottle. It's very misleading. It's great, attention grabbing headline to get someone to buy something. But
sure.
There are, things like, we talked about the growth hormone peptides, the MOTS-C. There's a few others as well that you can get to kind of work on that visceral fat. And the visceral is what's dangerous. It's surrounding your organs on the inside, and that contributes to some of that middle weight gain.
Because I know, like, for, I don't want to speak for everyone, but like most people in the world that want to take, some type of fat loss supplement, whether it's a peptide, stuff like that, they're looking to maybe target the love handles or the back a little bit like that. So what you're saying is you can't really just target it as a spot. You can kind of just target it as a group that you're going to focus on.
Yeah.
What peptide or what kind of field would that funnel in if you were to kind of guide someone in that direction?
It kind of depends on about how much fat loss they're looking for, right? I mean, there's benefit to taking GLP-1s for that, as well as the growth hormone secretagogues. That combination right there. I am a walking product of my product. I will post on my own personal social media what I looked like in December of 24 versus December of 25. I'm a small framed, I have teeny tiny bones. I was an athlete in high school. I played softball. I was a pitcher, but I didn't do the workouts. All I did was throw constantly. I didn't do the training when the rest of the team was. I was like, no, guys, I got to go throw. You guys run those. You guys run the sprints. I'm just going to go throw.
Yeah.
Never worked on muscle my entire life. And once I took the GLP-1s and I saw my body respond to dropping so much fat, and I had so much more energy, I'm like, I wonder what would happen if I just started doing 2 to 3 like baby weight workouts. And I'm talking like I don't want to exert myself, you know. And I saw my body start to change very quickly. So then I added sermorelin, which for most women, that is my ride or die BFF. Like, love that. It's a growth hormone secretagogue, and it targets visceral fat. It can help with some mental clarity. It is amazing for sleep and recovery. Because again, we have to talk about recovery with what we're doing in the gym. We've got to give our body time to recover from that. And you're better off with fewer workouts farther apart so that you can recover in between. And so the growth hormone secretagogues are great for that, inducing better sleep. And so with that and the GLP-1, I noticed my body composition change like crazy. Like, I have arm muscles that I physically have never had before.
Oh yeah.
Nice.
And now it's not about being small. It's about, how can I get my muscle to pop just a little bit more? You know, what else can I do with my body?
Oh, let's go. Let's dive right into this, because this is a fun one for me. I want to do a little exercise here where we kind of build a stack. All right, let's build me a peptide stack.
And this for our show, build Jack a staff.
Build me a stack.
Brought to you by Danielle with Momentum Integrative Wellness.
Let me know what peptides I should experiment with, or other things. Nothing's off limits. There's some things that are off limits, but we'll use discretion on that. So I kind of gave you a little bit of background on me. I'm active. I lift a lot of weights. I run a lot. I'm very conscious of my body composition. I like having muscles and being shredded. I want to look good with my shirt off, right? But I also want to be healthy. I want to feel good in the gym. I want to get the most out of my cardiovascular exercise. I want my hormones to be optimized. You know, all the bumps and bruises that I pick up when I'm working out, I want to make sure that I'm recovering quick. Money, throw it out the door. I'm not even thinking about it. Unlimited budget. What kind of peptides should I be taking right now? Is a GLP-1 something I should consider? It's not something I ever thought about. What do you think?
So first of all, I'm going to give you my disclaimer, because I am not a licensed healthcare professional. I cannot prescribe or diagnose you anything specifically, but I can give you, based on my knowledge of what peptides can do for an individual. And we haven't seen all of your lab work and all of the things, right? So this is a very general, educated recommendation. Okay, just want to put that disclaimer out there, everybody.
We are also not doctors.
I do not have a degree in this field.
Any peptide protocols in our longevity clinic are written and signed off on by a medical professional who's been doing this a lot longer than me. I've just been blessed to be trained under her. So we have what we call, I can't think of what the name of our signature program is. The Sentinel Circle. It's a 1-year-long program that we do, where we cycle some mitochondrial peptides, mitochondrial repair peptides, like an SS31. Do 2 cycles of that. We would do 3 cycles of your MOTS exercise in a bottle. Again, we will talk more about that. And that's really for the right person. This is not for a sedentary person. This is for somebody who is active, they are healthy, they're working on their nutrition, they're physically working on their body. They're not a cardiovascular pincushion, meaning they're not just sitting around and only lifting weights, but they're just active, right? Metabolically, they're in pretty good shape. We're also going to do some epitalin to lengthen those telomeres. So after we repair the mitochondria, then we want to do some epitalin, lengthen the telomeres. Then we want to use the MOTS to tell your mitochondria what to do with the energy, start utilizing the energy that's in your body again. Then we're going to use, of course, foundational Wolverine stack.
Can you give me the Wolverine clause? Can we edit that in?
I'm close, guys.
Very nice. Let's go. Oh, not bad. That's
That's
actually Sabretooth with the fingernail claws, but we can get into the comic book characters later.
We'll do a bit on that. Yeah.
That's one of the things I was going to say too with what you're talking about. Like,
I thought you were going to talk about nails. No, you're not contributing to that conversation.
It's like, you can't have a NASCAR without, all of the efficient parts to the same thing. Like, if you have your regular car, you can't just go put nitrous in your car and expect it to run like a NASCAR.
Yeah, I'll put it in my Civic.
Yeah, no, your car's going to blow up. So it's just like you said, you have to have, in the gym, eating correctly, sleeping, all these other things that people I don't think consider. It's a really good point to focus on, because it's not just the supplement. It's everything.
Very good point. Now back to my stack.
Back to your stack.
Let's go. Stack.
Back to Jack's stack.
All right, so what do we have so far? Let's put it on the board. So it's the first one.
We've got SS31.
Bring it on.
Epitalin, MOTS, all year long, we're going to run a Wolverine stack protocol. So you're going to be 2 months on, 2 weeks off, 2 months on, 2 weeks off.
And the Wolverine protocol is BPC 157
/ TB500.
TB500.
The heal and repair. We're going to target cellular or systemic inflammation. We're going to work on increasing blood flow. Again, it should be everyone's foundational peptide. We can use it acutely for, accelerating healing from injury or post-surgical protocols. You have a good orthopedic surgeon if the Wolverine stack is included in your post-surgical repair. And a lot of times it's not, but it should be. We're also going to use, you can choose your growth hormone secretagogue. So depending on where you are, I actually have a guy right now who told me, he's like, I'm not interested in any more muscle. He goes, I feel like I have too much muscle. I would really like to slim down.
I'd like to see this guy.
Yeah. Run him our name.
For his, he just wants to be smaller physique, right? So would I put him on Tessa-IPA? No, I would put him on Sermorelin. We would just keep that muscle lean and target the visceral fat, because Sermorelin's less of a bulking agent and more of a lean kind of cutting and sculpting agent. Not quite as strong as the big daddy that we call Tessamorelin.
Yeah.
So you would choose your growth hormone secretagogue there. And we would cycle that also 2 or 3 months on, 1 month off, depending on where you are. And then, so some of those are 2 and 3 times a year. And of course, with that protocol, you're going to get all of your labs drawn from us, no charge. You're going to have priority access if there were to be any additional shortages. It doesn't include GLP-1 therapy, because a lot of times that person may not need it, but you do get discounts on additional peptides like your DSIP if you're looking to re-regulate your circadian rhythm and enhance sleep. I'm trying to think if there's any others that I would.
Well, with that stack alone, I think I heard you say, is it a year or 6 months that Jack?
A year.
Okay, so in a year, if Jack, stayed consistent, was a good boy in the gym, didn't eat the donuts that were brought to the office this morning,
Always am a good boy.
kept on the right track. If he ran that stack, what kind of the differences? What's some of the things he would notice in the year that gone by, or some of the experiences you've had with someone doing a similar stack that long? What's some of the benefits that he would, right away kind of be able to point out, like, that helped?
So you should notice increase in energy right off the bat from doing the epitalin, the SS31, the epitalin, your MOTS-C. You should notice a difference in the overall amount of energy. Some people get a little sluggish with that at first too, because your body is really going through some readjustments. And so you might feel a little bit crappy during that while your body is kind of sussing out some other things that are going on. Just very top layman's terms here. And again, we don't always run those 3 together, right? That is more for the elite protocol for the average person. I hear a lot of people trying to run MOTS-C like all the time because they hear it's called exercise in the bottle. And really, your experts are going to cycle it 2 to 3 times a year. We're going to give you a high loading dose to let it do what it needs to do in your mitochondria, to let it remind it what it's supposed to do with the added energy, so then it continues to perform. It's not necessarily a maintenance peptide. If someone's going to attempt to use it as a maintenance peptide, they need to be a high physical hit, kind of like high intensity training, active person. But that is not your average person. The average person wanting these gains and these changes wants the biggest bang for their buck with the littlest amount of effort, because there's other things you want to go do in your life. So a professional athlete, they could do a MOTS-C, they could cycle it, or they could actually take it continuously on maintenance cycles because they've got the right level of activity.
Are peptides banned? Can an athlete take a peptide?
I don't know. We might have to call our water representative to dig into that.
I didn't even think of that until you just said that. Because you can't, like baseball, for example, you can't take steroids.
Right.
Steroids, but
Which is lame.
yeah, I mean, it was much cooler when they were.
There's a lot that they'll test for
But like,
that can still show up.
those also count as no-nos.
I think it depends on your
The pro
sport.
sport. Yeah. I'd like to know that.
Sport.
I'd like to know that.
Touchy one. But,
And then it really comes down to what kind of test are they running and what can they tell that you're taking.
Awesome.
There's, certain tests for certain things. I mean, growth hormone, anything that's going to be a growth hormone secretagogue, they're probably going to test your levels. And so it probably has to do with the level at which that they're not willing to let you perform with. But many of the other ones, I would think that they're going to be mostly untraceable. But again, I'm not.
Good thing my men's baseball league doesn't test for these things. Let's go. We're swinging.
Boom.
Let's ride.
With the peptides, is there like an age limit? Is there an age, requirement? Is it just something healthy you should be able to do all year round, like a creatine, for example? I mean, obviously it's stronger, different than creatine, but is there like a threshold, or is it pretty much just as long as you monitor what you're doing, you should be okay?
Typically, we don't have an age limit in terms of our older population. It really just depends on labs and how
What's going on inside?
Yeah, we really want to look at renal and hepatic function in our older patients. But I mean, I've got 85, 86-year-old women
Wow.
on GLP-1s. And it's actually great because it's great to improve their kidney function. So there's a lot of benefit to doing things the older that we get. When it comes to adolescence, I mean, we're not talking about peptides for kids under the age of 18.
Right.
And with a lot of them, you do want to be careful because your body's still changing and your body's producing a lot of these things at much higher rates when you're younger anyway. Do I have people who have put their kids on the Wolverine stack to heal from a surgical procedure, or injury when they're athletes? Absolutely. And that's going to be a personal choice between the parents and the medical professional in terms of appropriateness. But I mean, there are other medical conditions too that can exclude you from being appropriate for treatment, which is why people are just ordering their peptides online.
Yeah.
Without a consultation, that's a big
Right.
thing.
It's like I'm not gonna fill up my Bentley with whatever the average gas is. It's got to be high octane, and you got to be careful. You should not be able to order a peptide without a prescription or being signed off on those peptides for you by a medical professional.
And that's coming overseas, I'm assuming.
Listen,
Amazon? Can we confirm, right? Can you get it on Amazon?
I don't even want people ordering vitamins from Amazon because there's so many knockoffs, like not even your basics vitamin C, just don't get it from Amazon. But, going back to the pharmaceutical world and manufacturing, our sites, and I think I just saw RFK say he wants all pharmaceuticals, or maybe Trump said they want them all produced here in the United States. That's not freaking reasonable. I'm sorry. All the manufacturing sites are in rest of world. We just call it rest of world because it's cheaper to have a manufacturing site over there. Does the FDA technically have to go over and sign off on inspection for processes? Yes. Does the FDA get around long and often enough? No, they don't. The sites don't get in. But if you have an FDA regulated site where your product is coming from, at some point those standards are there and those qualities are there. And can things slip through the cracks? Yes, but that's different than a site that is not even ever on the radar to be inspected by the FDA. So they're all going to come from India, from China, maybe from Ireland, depending on where that site is. They shut down one of the largest manufacturing sites in the United States because it couldn't compete operating costs with rest of world. And we did manufacture a lot in the US. I came from one of the largest generic manufacturers of drug companies, which I'm not going to name, but I worked there for quite a long time. And so that's why I understand, some of this marketing that we talk about is not really correct. They're going to come from China. And that's not always a bad thing as long as it's the right site in China.
I think it ties into what you said earlier. Do your homework. Don't just order it online. Go see a professional doctor. Get your labs run. See what's going on.
No gray market peptides. You gotta watch out. And those sites are getting shut down like crazy.
Well, I remember we talked last week. We talked. We both took a pre-workout in college. It's called Psychotic.
Yeah.
I don't know if you've heard of that.
No,
Definitely not regulated.
No, but the name.
I know. It was like a picture of a clown with his eyes popping out of his head.
I think it had meth in it.
Yeah, it was. But then that was
sweet.
For caffeine, it was in I think it was close to 1,000. It was horrifically strong.
Yeah, I vomited for sure.
Yeah, it was terrible. And that was definitely not regulated. I didn't see a doctor or ask any advice. So don't do that.
Yeah, don't do that.
Yeah,
we don't do that, nor can we recommend that anybody does that.
Yeah.
Yeah, so we are running a little bit short on time, so I want to kind of wrap some things up and put a bow on it. I really quick just wanted to briefly attack the skeptics that are saying no to this new wave of peptides and regenerative medicine. There's tons of research coming out nowadays that are backing these things. What's your kind of message? Like my dad, right? I'm like, Dad, your shoulders are messed up, your knees messed up. Let's get you on a Wolverine stack. And he's like, no, I don't know anything about any of that stuff. I don't want to touch it. What do you say to a person like that you're speaking to, giving one of these consultations? It's a little bit apprehensive to anything that's labeled peptide.
Again, I'm going to provide them with the information that we have and then direct them to some other third-party resources that they can look at on their own. If what you're doing isn't working for you and you're still seeking solutions, then we're going to provide you with some of those solutions. And so, they are very safe just because many of these have not been, and I will explain this to people. You're not going to see clinical trials, human clinical trials done by the pharmaceutical companies because they're the ones who need to put to front. I mean, we're talking about millions, tens of 20s of millions of dollars to do these human clinical trials, to set them up properly. And they have to be phase 1, phase 2, phase 3. If the pharmaceutical company can't get their hands on this, because all it is a single molecule, and there's nothing else to add to it to create some novel compound that they can patent, then there's no incentive for them to do the human clinical trials. So we have to look at animal models that have been studied and talk about, how much you can extrapolate the data toward human. And then what has the human use factor kind of been out there? And what are people saying who have taken it and had these positive experiences? Because you can find a lot more positive experiences. There's very few contraindications in the world of peptides for people to have a negative effect from it. The biggest mistake I see is people throwing their money away because they're not cycling it properly or they're not taking it properly and they don't have the proper nutrition or a lifestyle to go along with it. And nothing's happening. They're taking it. It's fine. They're not necessarily having a bad result, but they're not really getting a result. So we try to make sure that you're getting the biggest bang for your buck if you're coming in for us, to see us, that you have a good understanding of what it means to create this new kind of healthy lifestyle. And it's a collaborative approach, right? If you only have room in your budget for one thing, we're going to figure out what's going to give you that biggest bang for your buck and help you maximize that along the way. So
Awesome.
Yeah. So take that, skeptics.
Yeah. Put that on the board.
So, in general, just to wrap things up, don't get your peptides from some weird gray market online supplement shop. It's not in your best interest. You don't know what that stuff is. You don't know where it's come from. See someone like Danielle here at Momentum Integrative Wellness. Get a consultation done. Check out your blood work. Speak to someone that understands the science and that can really help get you on track.
100%.
Awesome. Well, Miss Danielle, thank you for coming on the show today.
Yeah, this was fun.
I think that you have a very similar look at food and health and wellness that we do. So we definitely want you back. So we'll be looking forward to that. And thank you. Thank you so much.
Thanks, guys. Appreciate it.
Well, thanks again for watching another health and wellness video here at the Living Well podcast. We'll see you soon. Thank you.